This meeting is now being recorded.
Hello, my name is Brandy Ebert, and my project is entitled Standardized Simulations, Evaluating Critical Thinking in Blended Learning Classroom. Before I begin, I want to offer special thanks to my committee chair, Dr. Tona Leiker, and committee member, Dr. Julia Ann Reibel. Without their support and guidance along the way, I would not be where I am today. So thank you. Currently, the clinical component is often overlooked in classroom settings where baccalaureate nursing students take the theory portion of a course online and come to a campus location for the laboratory portion of the same course. This is known as a blended learning classroom. In addition, globalization has increasingly affected education, and more nursing students are choosing to enroll in these blended learning classrooms. Research has shown that simulation in labs can correct this lack of knowledge. Moreover, research has indicated memorization does not necessarily indicate an understanding of information. This is best done through hands-on learning, through simulation and scenario use. Thus, education needs to shift to this new model of understanding and applying information. At this time, however, nursing education in blended learning classrooms may lack the resources needed to teach this type of skill. Thus, that brings me to my problem statement. Nursing students enrolled in blended learning classrooms lack simulation experiences and the knowledge gained through these experiences to be successful in practice. In order to promote these critical thinking skills in learning, simulations must be implemented into these blended learning classrooms. Therefore, the purpose of this project was to evaluate critical thinking scores of students enrolled in blended learning courses both before and after completing a standardized simulation. Critical thinking skills are a vital component of the nursing profession and education. Thus, it is essential to teach and promote these skills within the classroom. Moreover, simulation can foster critical thinking and advanced learning both inside and outside the classroom. Thus, simulations can be used to provide nursing students with appropriate education to meet the needs for these indispensable nursing skills and acquire new knowledge in a risk-free learning environment. Nursing students can enhance their critical thinking skills by learning to understand a problem, work through its solutions, and understand available options and variables for each intervention. By studying the impact of simulation, this can lead to better decision-making among students and encourage additional usage in nursing schools. Thus, that brings me to my project question. In blended learning nursing courses, do standardized simulations improve critical thinking among students? To better understand my project question, the following definitions were explored. A blended learning nursing course is defined as a course in which a nursing student completes part of the theory credit hours of a course, including lesson content and examinations in an online delivery format. The student, however, completes the laboratory and/or clinical credit hours of the course on ground at a campus location. Critical thinking is defined as the intellectual ability to process and reason in order to guide beliefs or take informed action and ensure safe nursing practices and quality care. For purposes of this paper, standardized simulation was defined as a project or as a pre-created standardized scenario in which a student completed nursing skills in a supervised on-ground campus simulation laboratory. Further guiding this project was a theoretical framework of Bandura's social cognitive theory. The social cognitive theory is broken down into two pieces, self-efficacy and the triadic reciprocity. The theoretical framework will be tied in further into this project in the significance portion of this presentation. However, according to Bandura, immersing nurses in the right simulation in the right environment can build knowledge, skills, and traits needed to perform at high proficiency levels and build critical thinking skills. The study was conducted to examine the effects of standardized simulations on critical thinking scores among pre-licensure baccalaureate nursing students at a nursing school in a Midwestern state. Due to confidentiality purposes, the name of this nursing school will not be disclosed. In addition, to assess critical thinking, an overall critical thinking score was determined through administration of the Watson-Glaser critical thinking appraisal, both before and after a standardized simulation. The critical thinking appraisal consisted of 40 questions, and this instrument was already tested and validated and has been generalized and replicated on a variety of populations in order to investigate if there was a change in critical thinking after a simulation experience. The quantitative project contains limitations within its design. The sample size and access to the population within the project was small and limited due to organizational policy and nursing course availability. There was a lack of data within the project due to outside uncontrollable variables within the population, such as location, a variance in the distribution of material within the selected nursing course, and timing in which data was collected. In addition, the time in which to complete the project based on capstone guidelines was limited and resulted in a more restricted review of the literature, application of the methodology, and interpretation of the results. Lastly, the cost of the data collection instrument was identified as a limitation affecting sample size distribution. The literature was reviewed as part of this project and broken into 3 areas as part of the research question. These included critical thinking, blended learning classrooms, and standardized simulation. Detailed aspects of this literature review will be tied in the results section and significant section of this project presentation. However, critical thinking was shown to be increased as well as knowledge with the use of simulation. Learner engagement and outcomes were also enhanced with the use of simulation, and simulations improved a variety of cognitive areas and performance. Next, it was shown there was a crucial impact of simulation when integrated into the curricula of blended learning classrooms. The use of simulation in blended learning classrooms also was shown to have significant improvements in examination scores, and simulation in online education is preferred for both learner and instructor. Next, it was found that standardized simulations improved nursing and critical thinking skills, as well as examination scores when supplemented with educational programs. Simulations also better prepared students for practice and increased knowledge retention. A quantitative quasi-experimental design was selected for this project and explained the relationships and connections between the variables within the project question using limited manipulation of the instrument, setting, and selection of the subject. By using the quantitative experimental design, the connection between standardized simulations and critical thinking, as evidenced by the scores on the Watson-Glaser critical thinking appraisal, was tested. The instrument collected quantitative data through a critical thinking assessment and provided an overall numerical score for the pre-test version of the critical thinking appraisal and a post-test version of the critical thinking appraisal. For this project, a single convenient sample of 22 pre-licensure baccalaureate nursing students enrolled in a clinical laboratory course was obtained from a total of 23 available participants for the allotted data collection period. One individual, however, was absent during the data collection and unable to participate. All available participants, however, volunteered to participate. As part of the inclusion criteria for participation in this project, the individual must have been enrolled in a blended learning nursing course and in a scheduled laboratory session at a school of nursing in the Midwestern states. Demographics for individual participants were not obtained due to potential identifying information. However, overall institutional demographics were provided. This will be discussed later in the presentation. The Watson-Glaser critical thinking appraisal was used to assess students' critical thinking skills and abilities and was administered online to measure the problem-solving, problem recognition, and decision-making tendencies among an adult population. This tool was validated in a post-secondary school population, uses no technical vocabulary, and was completed in a maximum of 35 minutes. The Watson-Glaser critical thinking appraisal measured critical thinking on a 40-item assessment. In addition, according to the test producer, critical thinking is based on the ability to define a problem, select a solution through vital information, recognize assumptions, and formulate and validate a conclusion. An individual scoring less than the 30th percentile was described as below average, while those individuals scoring between the 31st and the 70th percentile were considered moderately consistent and skilled, and those testers with a score above the 70th percentile were considered highly skilled and consistent. For purposes of this project, however, an overall critical thinking score was provided. Using the Cronbach's alpha statistic and test-retest reliability, the reliability coefficient for the Watson-Glaser critical thinking appraisal ranged between 0.81 and 0.89 for the Cronbach alpha and 0.81 to 0.83 for the test-retest reliability. This is strongly reliable for both statistics. Items on the Watson-Glaser were collected and validated from critical thinking assessment items tested over the last 20 years and have been extensively validated to provide a connection from critical thinking and correlated with the cognitive ability, occupational and educational attainment, and job performance. The next couple of slides show sample questions from the Watson-Glaser critical thinking appraisal and areas which were assessed, such as inference and recognition, deduction and interpretation, and evaluation. After receiving IRB approval from American Sentinel University and a School of Nursing in a Midwestern state, the campus was contacted to determine the time and date in which students would be scheduled to complete their standardized simulation in a blended learning nursing course. On the day the students were scheduled to complete the standardized simulation, a full disclosure discussing the project was provided, and voluntary participants were asked to consent to participate in the study. Consent was done and validated by clicking the link in which the students would complete the Watson-Glaser critical thinking appraisal. Again, identification of individual participants through demographics were not provided. After consenting to participate in the study, participants were given a unique ID login and password known only to them, in which they would use this information to log in to complete both their pre-test version of the critical thinking appraisal and the post-test version of the critical thinking appraisal. This allowed for the pre-test and the post-test scores to be matched up. After receiving their unique ID login and password, students use this information to log in and complete their pre-test version of the critical thinking appraisal. After completion of the pre-test, students participated in their normally scheduled simulation, beginning with 30 minutes of pre-debriefing, the actual simulation, and followed by a post-debriefing led by faculty. The simulation consisted of a nursing assessment, medication administration, and a physical assessment of the respiratory system. Faculty, again, helped lead the pre-briefing and the post-debriefing through a prepared model and reviewing key concepts and content with students. After completing the standardized simulation, students used the same ID login information that they used to complete the pre-test version to complete the post-test version of the critical thinking appraisal. Scores from the pre-test and the post-test were put into an Excel spreadsheet and later loaded into SPSS for analysis. Data analysis for this project included a paired sample t-test to compare the use of a standardized simulation to students' critical thinking scores as indicated on the Watson-Glaser critical thinking appraisal. After a p-value was established using the appropriate degree of freedom, a p-value was determined to conclude statistical significance and support the effects of standardized simulation on critical thinking scores among pre-licensure baccalaureate nursing students. IRB approval was received from the American Sentinel University as well as the nursing school in the Midwestern states. Confidentiality was maintained for all participants as no identifying information was collected, and unique ID logins and passwords were provided to participants and known only to them. Any data collection forms were kept in a locked file cabinet in a personal office of the individual collecting data in order to minimize theft and possible security infringement. The project site's IRB requires that the data be kept for 7 years as opposed to the American Sentinel policy of 5 years. Thus, after 7 years of conclusion of the study, the consent forms and data collection forms will be shredded, IP addresses will be disabled, and the website will be encrypted. In addition, involvement in this project was voluntary, and participants were able to refuse to participate at any time within the project without consequences. Lastly, the principal investigator had no association with any of the students. There were no known emotional or physical risks participating in this project. Anonymity was maintained. Participants could volunteer or voluntarily exit the study at any time, and all questions about the project were directed to the American Sentinel University IRB Review Board. The guidelines for an appropriate sample size for a paired t-test was conducted using a G-power analysis. According to SPSS, it was necessary to adjust the alpha level to 0.15 rather than the traditional 0.05 for small group sizes in order to yield a significant power. In addition, the effect size was calculated using the eta squared value, yielding 0.50. Therefore, using a G-power analysis with an effect size of 0.50, an alpha of 0.15, and a minimum power of 0.80, the appropriate sample size for this study was deemed appropriate at 22. Part of the inclusion criteria for participation in this project included that the individual must have been enrolled in a blended learning nursing course and in a scheduled laboratory session at the School of Nursing in a Midwestern state. Due to confidentiality concerns, individual demographic was not reported. Overall, the institutional data, however, was reported. It can be seen that 11% of the institution are male, 89% female, 49% is 24 years and younger, and 51% was 25 years and older. The Watson-Glaser Critical Thinking Appraisal assessed students' critical thinking scores before a simulation. This is indicated as a pre-WG2, and after a simulation, indicated as post-WG2. An overall critical thinking score was reported for the pre-test and the post-test on a scale from 0 to 40. For a paired t-test analysis, however, there are general assumptions that should apply to all the parametric techniques evaluated. First, with a paired t-test, it is assumed that the dependent variable is measured using only continuous rather than a categorical scale. For purposes of this project, only continuous variables were explored through an overall critical thinking score. An individual participant demographic was not collected. This type of scale gave wider range for analysis. Next, it is assumed that overall scores are obtained using random sampling. However, for research, this is not usually the case and does not affect the result of the project. In addition, it is assumed that data observations are independent of each other. In other words, one measurement does not affect the other. For this study, group or outside influences were not manipulated to affect the data outcome. Also, a power and effect size should be determined to be appropriate. Again, a G-power analysis was conducted with an effect size determined to be 0.50, indicating a large effect, an alpha of 0.15, and a minimum power of 0.80, indicating a sample size of 22 was appropriate. In addition, for a paired t-test, it is assumed that the sample data is normally distributed. Normality of this project was assessed by the given results of the Kolmogorov-Smirnov statistic. This can be seen in Table 4 and is indicated by a sig value above 0.05 at 0.205 for the pretest and 0.529 for the post-test, indicating normality. In addition, the shape of the distribution of the pretest on the left in Figure 1 and the post-test in the right in Figure 2 were provided as a histogram, and the shape indicates normality. Moreover, the normal QQ plots for the pre-test in Figure 3 on the left and the post-test in Figure 4 on the right were provided, and the observed value for each score in Figure 3 and Figure 4 were plotted against the expected value from the normal distribution. This reasonably straight line indicates normal distribution. As part of this analysis, overall significance, including the mean, degrees of freedom, p-value, effect size, power analysis, and normal distribution were analyzed. For this type of analysis, the mean scores from the pre-test and the post-test were evaluated to determine if there was a statistically significant difference as the result of the simulation intervention. The mean value of the pretest was 17.6, and the mean value of the post-test was found to be 19.9. This can be seen in Table 6. Therefore, it can be seen that there was an increase from the pretest to the post-test of 2.27. The effect size for the paired t-test was also calculated to determine magnitude of the simulation's effect on critical thinking scores. This was done by calculating the eta squared, yielding a 0.5, which indicates a large effect and a difference in critical thinking scores as a result of simulation. Overall, a paired sample t-test was conducted to evaluate the impact simulation has on critical thinking scores of pre-licensure baccalaureate nursing students in a blended learning nursing course. There was a statistically significant increase in critical thinking scores as evident by an increase in the Watson-Glaser critical thinking appraisal from the pre-test to the post-test. Due to an increase in distance learning, advanced technology, and globalization, simulation in nursing classrooms are becoming more prevalent. In fact, the literature has shown that many states are allowing institutions in nursing education to replace clinical time with simulation. The literature has also shown that this has resulted in an education shift focused on hands-on learning and applying information in real-life settings through simulated experiences. Moreover, the literature supported the importance of simulation and its impact on critical thinking, particularly in blended learning classrooms. In addition, according to Bandura's social cognitive theory, this type of learning through simulation impacts decision-making and critical thinking. For instance, this theory suggests that the right environment and setting through simulation can impact and build knowledge, skills, and traits needed to practice effectively, in turn enhancing clinical reasoning and critical thinking. This has suggested that individuals do not complete tasks and behaviors guided by force, but rather are influenced by outside stimuli such as the environment, personal factors, and behavioral factors. This is known as the model of triadic reciprocity and can be seen here in the diagram. In other words, it is suggested that beliefs, emotions, and outside stimuli guide behavior and action. Thus, the simulated environment, through the use of experience, role modeling, and reciprocal learning between instructor and student, can act to guide behavior and further guide thinking and action. Thus, according to Bandura's social cognitive theory, again, immersing nurses in the right simulation in the right environment can build knowledge, skills, and traits needed to perform highly. The overall results from the pre-test and the post-test critical thinking appraisal concluded there was a statistically significant increase in critical thinking scores from the pre-test to the post-test, with a mean increase of 2.27. G-power analysis showed that the sample size was appropriate, and the results proved the environment for participants positively impacted and improved critical thinking. Thus, to answer the research question for this study, it is evidence that standardized simulations do improve critical thinking among students in blended learning nursing courses. Because there was a statistically significant and positive increase found between standardized simulation and critical thinking, there are implications as standardized simulations may be able to address concerns in nursing education and healthcare. For instance, as healthcare and education continue to evolve and focus on sentinel events and patient safety, it is important nursing students in clinical as well as nursing graduates are able to function safely and effectively in these settings. This can be fostered and critical thinking improved in order to act quickly through the use of simulation prior to graduation in a nursing course. At the same time, however, there has been an increased expectation from nursing educators, testing administrators, and healthcare facilities that nursing students and new graduates be able to critically think, provide competent care, and harbor advanced clinical reasoning in a variety of clinical settings. As a result of these increased pressures, nursing students and new nursing graduates may not be prepared to perform safely and competently as they lack the experiences and skills needed. This can have negative impact. Overall, the results and Bandura's social cognitive theory prove the environment through simulation positively affects knowledge and critical thinking. Improved critical thinking gained through simulation will result in increased patient safety, improved competent care, and positive student outcomes. Thus, nursing schools and nursing leaders must become invested in preparing nursing students to enhance their skills, experiences, and knowledge prior to graduation through simulation use. In order for simulation usage in nursing schools to have the most effect, it must be implemented into core curricula. The literature has indicated simulation can improve knowledge retention, and its application in clinical settings can be beneficial. Because of financial hardships, however, hospitals and other facilities can no longer afford to provide a lengthy orientation to train new graduates. Instead, employers are relying on nursing school educators to prepare these students. One of the ways this can be done through nursing school is through the use of simulation. Simulation combined with clinical and teaching experiences is a powerful tool for training and improving critical thinking. Thus, simulations must be incorporated into nursing curricula. In current nursing curricula, pre-licensure baccalaureate students may lack critical thinking skills necessary to practice safely and effectively. This can result in poor patient outcomes and high-risk situations for healthcare sites and clinical sites. Students who fail to appropriately develop their critical thinking skills may perform poorly in the classroom and on standardized simulations. Thus, it is critical that nursing education provide training and knowledge to foster critical thinking skills and eliminate these negative outcomes through the use of simulation. Future research recommendations would include increasing the sample size to include additional participants. For the existing project, the convenient sample was large enough to yield a minimum power of 0.80. Future research, however, should focus on increasing the study's power to 0.95 with a larger sample size. In addition, participants in future research should be expanded to other nursing institutions in the United States in order to provide a more generalized view and representation of a large population. Additional research should also explore the impact simulation has on critical thinking in other blended learning nursing courses at all levels within a nursing program. Additional time should be allotted in future research between pre- and post-testing to explore the true effects simulation has on critical thinking. According to the test producer, additional time between testing may be needed to explore true learning outcomes and assessment techniques evaluated on the Watson-Glaser critical thinking appraisal. Additional manipulation of the study could be made in future research to evaluate the impact simulation has on critical thinking among nursing students. For instance, according to Bandura's social cognitive theory, all aspects of an environment may impact learning, skills, and knowledge. Thus, future research could explore whether the impact of the actual technology of the simulation scenario improves critical thinking, or if it was attributed to the interactions with peers and faculty during debriefing. Results of this project have shown that the use of standardized simulation and pre-licensure baccalaureate nursing courses and curricula can improve critical thinking and student outcomes among pre-licensure baccalaureate nursing students in blended learning classrooms. Overall, it is recommended future research be replicated and focus on increasing sample size, providing a larger area of population representation, examining simulation effects on additional blended learning nursing courses, and allow for additional time between pre- and post-testing. The next couple of slides show the references that were used to guide my project. And thank you for viewing my presentation.